All right. So, again, welcome to our webinar series, Spotlight on Structured Literacy. My name is Lama Farhan, and I serve on the IDA Georgia Board of Directors, and I'm co-chair of the webinar and conference committees. On behalf of the boards of both IDA and the Reading League Georgia, we are pleased to be offering this webinar series for the fourth year. IDA and the Reading League are committed to providing information on evidence-based practices to educators, parents, and advocates. In doing so, we hope all students will have access to structured literacy instruction. In this four-part series, our speakers draw on the science of reading and the science of the teaching of reading. In tonight's webinar, Tatyana Elleseff will discuss the attention deficit hyperactivity disorder, or ADHD, is characterized by difficulties with focus and impulsivity. Too often, children with ADHD suffer from academic difficulties that are attributed solely to attention deficits, while the underlying language and literacy challenges go unrecognized, leading to inadequate assessments and ineffective one-size-fits-all interventions. In this presentation, Tatyana will highlight how overlooked linguistic and cognitive difficulties contribute to academic and social challenges. Attendees will gain a deeper understanding of why high-quality language and literacy evaluations are essential for accurate diagnosis and individualized support, along with practical evidence-based strategies to better serve students with ADHD in educational and clinical settings. Before we begin, thank you to those who submitted questions when you registered for this webinar. As a reminder, if you have other questions, please put them in the chat box. The chat will be monitored this evening by Elizabeth Hogan, President of the Reading League Georgia. During the Q&A, our speaker will address as many of your questions as time allows. And now, Stacy will introduce our speakers. Stacy.
Thank you, Lama. My name is Stacy Levy, and I am the current president of IDA Georgia. And it is my pleasure to introduce Tatyana Elleseff. Tatyana is a bilingual speech-language pathologist specializing in complex language and literacy disorders, particularly among at-risk youth with psychiatric impairments. A graduate of NYU with a bilingual education extension certificate from Columbia, she serves as a clinical instructor at Robert Wood Johnson Medical School and a clinical supervisor at Rutgers Day School. She has published widely and presented internationally on topics including dyslexia, language disorders, social communication, bilingualism, and fetal alcohol syndrome disorders. She provides comprehensive evaluations, therapy, and consultations, emphasizing evidence-based, individualized assessments and interventions. Please join me in welcoming Tatyana Elleseff.
Stacy, thank you, and Lama, thank you so much for this wonderful introduction. I am so thrilled that you guys invited me to speak. And now, without further ado, allow me to share my screen so we can get started. One of the things I wanted to point out is that as I was looking at the attendees, give me just 1 second to swap screens. As I was looking who was here, I was so thrilled to see so many people who I know, who, I've met and who I've interacted with. So it's such a pleasure to have you guys here. I'm very excited. All right. So what we're going to talk today about is we want to talk about how to identify language and literacy deficits in children who are diagnosed with ADHD, or children with suspected ADHD, or children who present with a certain type of symptomology. We want to talk about what's the best way that parents and professionals can advocate for comprehensive language assessments and specific individualized intervention to support these students. And then we want to talk about evidence-based strategies to improve language literacy and executive functioning in these students in clinical and educational settings. And this is a goal for today. And I'll try to make sure I'll leave plenty of room for questions. And again, if if I'm allowed, I'm happy to stay later and answer all the questions you guys may have, because I know what important this topic is. Okay. So let's talk about the current controversies which exist, specifically on as related not just to ADHD, but to language, since the scope of this presentation is specific to developmental language disorder or language difficulties. And not sure how many people caught the New York Times article this Sunday discussing ADHD, but that certainly lit an even bigger, fuel under that fire and kind of like brought in the controversy also into the prominence. So what does ADHD and DLD controversy is about specifically? Well, there's a number of points. Number one is the most common one. There tends to be a misdiagnosis of ADHD in kids with language disorders. We have specific type of difficulties, such as, trouble following directions, impulsively speaking, tuning out, zoning out, not paying attention, and right away, it's mistaken for attentional issues instead of, ADHD misdiagnosis. That's an oldie but goodie. Oftentimes what happens, the language impairments in kids diagnosed with ADHD may be completely overlooked. So what ends up happening is someone comes in and says, okay, my child has been diagnosed by a psychologist or psychiatrist with ADHD. So with respect to educational classification, the child may be commonly classified under OHI, classification. And then what may end up happening after that is absolutely nothing. Somebody has that OHI classification, and all of a sudden it's like, okay, well, here's your 504 plan, or here's nothing for you, and then you just have your co-occurring language disorder is completely undiagnosed and untreated. And that happens actually quite frequently in many different settings. It's one of the common reasons why I see kids at both hospital setting and private practice, because it's actually one of the side effects, which happens to be of this particular diagnosis when it comes to certain school districts, certain schools, certain states, etc. We have bias in diagnostic tools. I mean, specifically when it comes to, well, because there is no ADHD biomarker, because you can't really identify ADHD on a scan. You can't identify ADHD through a blood test. What are you relying? You're relying basically on teacher and parent observation. And the problem with those, whenever we're involving other people instead of objective measures, those type of measures tend to be inherently quite biased. It's very difficult to differentiate between inattention due to ADHD and a language deficit. It's simply because, you have your professionals who are coming in, with certain biases, and they may be, judging a child accordingly, which may or may not be objective. And then there is, something that the New York Times article discussed, and that is medication versus language intervention. There's certainly concerns, especially when it comes to certain population of children, that stimulant medication is often prescribed, but without addressing the underlying or current language processing issues. And that is something that also tends to be quite common, especially if the people prescribing the medication are not making any additional referrals for, language assessments, for educational assessments, and so on and so forth. And that part is very, very important. Who tends to be misdiagnosed? Quite a number of times, multilingual learners get misdiagnosed. Bilingual learners can get misdiagnosed. Learners with limited English proficiency, according to research, are likely to be misdiagnosed with ADHD due to communication breakdown and language confusion. Then there is discrepancies in access of who actually gets evaluations. And again, depending on the system you're in, there's a huge disparity. Children from low-income households or minority backgrounds typically may have problems accessing speech-language evaluations alongside with ADHD assessment. And that, of course, increases the risk of diagnostic error. And that part is very important to understand, because research also shows us who gets disproportionately overprescribed medications. And medications tend to be overprescribed to children from low SES backgrounds, and particularly children on Medicaid. And we have quite a bit of research to support that if anybody wanted references later. Okay. A little bit about, very briefly, on ADHD and overdiagnosis. So let's talk about some of the recent studies in the last, 5 to 10 years. So here's a couple of studies, and these studies are rather common given the current status of, ADHD diagnosis in the United States and in the world. So here's a few things. First is the typical developmental immaturity and misinterpretation of behavior. Sorry, it's late in the day. So Ford Jones emphasized basically that, and this is quite common, youngest children in the classroom may display developmentally typical behaviors to them in terms of high activity or limited attention, but they may be wrongly interpreted as symptoms of ADHD as compared to children who are a little bit older in the same classroom who are behaving more maturely. And this is a repetition of multiple studies which have been done, including one study which I think has been done by an economist in, I think, 2010, which basically supported that fact. Then there is the issues with the comprehensiveness of medical evaluation. So we have a static study from 2023, and something that was mentioned in the New York Times article as well. A lot of these ADHD assessments rely on behavioral checklists without what they call thorough medical evaluations. So the argument here is there is more risk of misdiagnosis, especially when symptoms may stem from other, medical, psychological, and social factors. And that is certainly the case. There are certain disorders which definitely will mirror ADHD. Some examples are sleep apnea. If a child is having sleep apnea and is having difficulty breathing at night and is sleeping very poorly, it is entirely possible that during the day, the child may be tuning out, very inattentive, because they're just having difficulty focusing because they really don't sleep well at night. Any issues with your metabolic system, any issues with your endocrine system, you may have difficulty and examples of behavior which are very similar to ADHD. Any form of stress or trauma, children with post-traumatic stress disorder will absolutely present with symptoms of ADHD, but in reality, they may be suffering from, trauma, and they require, different type of approach. And those are just some of the examples as related to medical, psychosocial, or even social factors. If you are in a shelter, if you have, if you are homeless, if you don't have a lot of food on the table, you may be in a position of extreme stressors and stress. And as a result of that, your symptomology could be attributed to ADHD, but in reality, you have certain stressors in your life which mimic those symptoms. So, multiple researchers have found evidence of what we call global overdiagnosis patterns, because when we do scoping reviews, we definitely find there's quite a bit of overdiagnosis, particularly in what we call high-income countries. And the contributing factors are oftentimes, the expansions in the diagnostic criteria. There's a pressure on parents and teachers for quick solutions. And also there is increased awareness, but without the clinical nuance. So where does ADHD, for example, gets diagnosed right now? Actually on TikTok. So if you just put in a simple Google search, you will see what's happening with the state of affairs as related with ADHD on TikTok. And it's honestly really, really terrifying. But I digress. So then we have information on trend data and diagnostic accuracy. So you have certain researchers who looked at the ADHD diagnostic rates, and they questioned what is this, reflecting? Is it increased awareness? Or is it true prevalence? They basically cautioned that diagnostic inflation is actually, again, a result of subjective assessments, or there is a tendency to jump the gun and medicate versus exploring differential diagnoses. And that's exactly what we're trying to do today. We're actually actively trying to explore differential diagnoses. And again, I wanna, just in case it's not clear what this presentation is about, this presentation is absolutely not anti-psychiatry. This presentation is not anti-ADHD, and it's not anti-medication. What this presentation is about is truly exploring and thoughtfully thinking about differential diagnoses, and particularly the contributors of language to the situation, which may muddle the results and complicate the issue, but will ultimately, once teased out appropriately, will assist the children properly. So this is what that presentation is about. So let's talk about what we call developmental language disorder. So developmental language disorder is a disorder of many different names. We can call it a language impairment, or we can call it SLI, specific language impairment. Used to be called many years ago, childhood brain aphasia, whatever you want to call it. The current terminology based on the Catalyze project circa 2016 is DLD, or developmental language disorder. It's an umbrella term which refers to a brain-based condition. It affects how kids understand and use language. It impacts what you comprehend. It impacts how you speak. It will impact how you read. It will impact how you write, and it will impact your social communication. DLD and ADHD, they share a lot of overlapping symptoms, and many students with undiagnosed language issues will be mistakenly assumed to have attention deficits. The problem is, it's going to lead to wrong interventions and missed opportunities for effective support. That's why we need to bring out DLD and give it as much exposure as possible so people are more thoughtful about their diagnostic practices in every setting, be it in school, in a psychologist's office, in private practice, and so on and so forth. Let's talk about the symptomology for DLD. We have the delayed language development. It's not always going to be very overt. These kids may be late to talk. These kids may be slow to combine words in early childhood, but there's always exceptions. There's going to be some kids who are going to be developing normally because their issues are a lot more subtle. So there may be a subset of kids who will be early talkers, will speak in full sentences by 18 months of age, but they may have different symptomology, which does not exclude DLD. And we'll talk more about it, why their issues may be later confused for ADHD. Limited vocabulary, when they struggle to learn and use new words, yes, it's possible, or the reverse. Somebody would have very expensive vocabulary. Somebody has amazing lexicon, but they have this rich vocabulary they cannot use. And when they speak gibberish and they speak nonsense. And their sentences don't make sense because they're stringing together sophisticated words, but it's all like, a Gilbert and Sullivan opera. The Pirates of Penzance. They may have grammatical difficulties or they may not. They may have errors with verb tenses and sentence structure and word endings, or they may have none of those grammatical issues. They may have issues instead with word finding, which we'll mention a little bit later. They may have difficulties following directions or grasping complex sentences, or they may really struggle finding that word for a particular type of conversational purpose, or tell a story, or even explain something logically without confusing themselves and confusing their listeners. They may have frequent pauses, or they may use very vague words. Instead of having rich lexicon, they may be overusing certain words, like, thing, stuff, and so on and so forth. They may misinterpret situations, they may misinterpret conversations, they may struggle to stay on topic, they may have difficulty with what we call perspective taking, putting themselves into somebody else's shoes, being in those situations and imagining what somebody thinks in a particular situation or what somebody feels in a particular situation. And of course, there's going to be academic impact. Reading, writing, classroom learning, they're definitely going to be affected. Sometimes a little bit or sometimes a lot. Really depends on the school, depends on the classroom, depends on the teacher. So that's why we may have quite a significant symptoms overlap. Poor listening skills? Well, kids with DLD may be misunderstood because they have difficulty processing language, not because they're not paying attention. Difficulty following directions. Well, they may not understand them. They may not know how to follow complex instructions. They may have trouble with storytelling They may have struggle using particular words. They may not be coherent and cohesive when it comes to expressing their ideas clearly due to limited vocabulary and limited grammar and syntax. Kids with developmental language disorder also have certain non-linguistic factors affected, and that may be their memory or it could be their processing. So they may struggle with holding and manipulating verbal information, and that's going to affect their attention and language. But they may also present with very, very slowed processing speed. It may take them much longer than a typical peer their age to process information, to answer a question as quickly as the other peer, or just even deal with a situation as quickly as typically developing peer. That may translate into taking extraordinarily long time to finish homework, taking a very long time to complete a test, and so on and so forth. Social communication challenges. Kids with DLD have a tendency to misinterpret social cues. They interrupt and struggle with conversational flow, and that comes from their pragmatic language deficits. Beginning with approximately, I want to say 2021, we started getting more and more studies which show that pragmatic and social issues in kids with DLD are actually just as significant and profound as in kids with autism spectrum disorder. So we now have more information to show it's not that just kids with autism who have pragmatic language deficits, which are, pretty profound. So do kids with DLD. And then, of course, these kids have a tendency to present with academic underachievement. Reading, writing, and comprehension will show underlying literacy struggles, difficulty organizing thoughts, delayed language development. This is all symptomology which may be related to DLD. Very important to keep that in mind. But then what happens in the schools? So when you have a diagnosis of ADHD, some schools will deal with it quite well. Not always, and not all the schools. What may happen, and what does frequently happen in certain schools, in certain states, in certain districts, once a child is diagnosed with ADHD, what may end up happening is that educators and support staff is basically going to say, okay, all of your academic and behavior issues are just due to ADHD. That's it. You don't need anything else. You don't need any further assessments. You don't need anything at all because all of your problems are due to ADHD. So forget about you. We're just going to give you a 504 plan, or we're just going to give you a bunch of some accommodations, but you don't need anything else. So what's going to end up happening is that potential underlying issues, reading issues, pragmatic issues, they may be overlooked, they may be dismissed, and then that child is not getting appropriate intervention, that child is not getting appropriate support because ADHD had that label. It became a catch-all explanation. It just started overshadowing all co-occurrent conditions which require evaluation and therapy because all people can see is ADHD, and it essentially becomes a very convenient scapegoat in a number of situations. So this leads me to talk about some common educational assessments. And this is a part where I do want to emphasize and mention that there is a significant difference between educational assessments and language and literacy assessments, particularly speech and language assessments of a certain caliber, but we'll get to that. So what are some of the more common educational assessments? Well, we have the Woodcock-Johnson, the Wexler, the Kaufman, and the Pfeiffer. And those are typically the most common educational assessments one might see being given by, depending on your state, of course, educational or learning consultants, depending on your state, or psychologists, and so on and so forth. All of these measures have something in common. They're typically measuring academic skills. They look at math, they look at reading, they look at writing. They look at a wide range of academic skills. They may start at early literacy and go to advanced math. A lot of times they're paired with cognitive testing. They look at strengths and weaknesses. Sometimes they look at dyslexia subtypes. So they look at many, many different things. Now, this is what they all have in common. They measure academic skills. They may identify areas of concern. The problem is they do not diagnose language disorders. They will be used for IEP eligibility, but they're not sufficient to diagnose language disorders, not at all. DLD requires specialized language testing, and you need to use psychometrically strong tests. And lately, there's been so much miscommunication and misinformation about it, but it's really, quite frankly, getting ridiculous because people really need to know and understand if a test is designed for a particular purpose. Can a test truly recognize something which is, important to academics? Can a test tease it out? And that part is very, very important when it comes to good quality testing. What ends up happening with quite a number of students with DLD, and I'm talking about anyone who is not very severely impaired, because if a child is very severely impaired, you're going to see it right away. It's very, very apparent. But many kids with DLD are not so severely impaired, and it's not so apparent. They may score really well in an average range on general academic language tests, and that's going to mask their true deficits. Without targeted language testing, schools again may misattribute language-based struggles to attentional issues. And again, these kids will be overlooked. So, identifying language and literacy deficits. What do we do? What do we need to do for best practices? As an SLP, and what all SLPs typically should do, we need to look at detailed developmental and academic history. You want to look at somebody's early speech and language milestone. You want to look at the history of delayed talking. You want to look at difficulty in all of these speaking areas or social communication areas or reading and writing areas. You want to look at all of that. So in other words, you need like a good quality checklist or good quality summary from parents or teachers detailing some of that information. That's what you need in order to get started. Then you need assessments which are higher in psychometric properties. There's quite a number of tests which are not ideal for identifying language impairments or pragmatic language impairments in kids. I personally have a strong preference for these tests, the test of integrated language and literacy and the clinical assessment of pragmatics. My preference only comes from one very simple for one very simple reason. They have better sensitivity and specificity, or what we call discriminant accuracy. Now, the interesting part is that a lot of times when I talk about these tests, nobody ever asks me, is there anything about these tests you don't like? And that's a question which I would gladly answer, and I would say, actually, yes, there's lots of things what I wish these tests would do better. And I think they should be supplemented by additional type of assessments. And they should be supplemented by clinical tasks. And they should be supplemented by grade level assessments of reading and writing and narratives. So just because I am talking about these tests doesn't mean that I have unequivocal support for them. They have limitations because all standardized tests have limitations. But currently, on the market, they do have the strongest psychometric properties. And that's very important when it comes to teasing out language and learning difficulties, especially when you are a school-based SLP, especially when you don't have a lot of time for an assessment, when you have very limited amount of minutes and hours to devote to this. That part becomes very important. You only want to use the most psychometrically stronger assessments. You don't want to use something that's not useful to you. So that brings us to the topic of, well, what if you have a bunch of tests in front of you? What if you have a bunch of educational tests in front of you, and your educational tests are basically showing you that the kid is doing fine? But what if your psychometrically stronger, language tests are actually showing you, no, they're not fine. They're actually impaired. How do you even look at that? And what ends up happening in among many professionals, there starts to get to be quite a bit of a confusion. People are going to say, they're going to misattribute inconsistent test scores to poor focus, but in reality, when you have these score discrepancies, actually what they're revealing is what each test actually measures. So for example, if on a WIAD the scores are average, but on a TILS the scores are low, actually TILS managed to capture the kid's language deficits and not just in attention. If a kid in the classroom has a really strong performance on multiple choice, but can't respond in these very weak and open-ended responses, that actually reflects the fact that there is expressive language challenges and not a lack of effort, because multiple choice performance is much easier than answering open-ended questions. So the point here is discrepancies like that will often signal a language disorder and not an attention issue. And then they will require specialized intervention and not just support with behavior. So what happens when there is misdiagnosis? Well, misdiagnosis will lead to misguided interventions. When you have a language disorder, which is mistaken for ADHD, what's going to happen is that students are going to be given behavioral interventions. They may get extra time on tests, they can get stimulant medication, but it's not going to address their learning needs because it's not what it's there for. So what these kids will need, they're going to need some good quality therapy to build their oral language and pragmatic language ability. And they're going to need some structured literacy approaches to support reading, spelling, and writing development. So what typically works? What is evidence-based and what is not? Well, what is very important in our field is something called contextualized language intervention. For many, many years, intervention in speech pathology was actually decontextualized. So what was happening was, kids may get a bunch of different cards, and for the first 10 minutes, they may be working on pronouns. Then for the next 10 minutes, they may be working on categories. Then after that, they may be working on sentence building. But all of it is done with different materials, completely in isolation, and it's not salient to the children. So they were basically forgetting everything they were learning, and they were taking away from therapy, very little. Then a number of researchers in our field started looking at what we call contextualized language intervention. So what contextualized language intervention is that it's a treatment approach, and it teaches steps in terms of basically you can address multiple linguistic targets in one meaningful session and through meaningful activities. And in fact, you don't have to stick to one session. You can teach multiple linguistic targets across a set of 5 sessions or 6 sessions in continuity and really make sure that that information actually sticks. So what the contextualized language intervention emphasizes is that you can improve multiple areas of language at once. You can use very purposeful, very functional activities in a context which are very kind of memorable to the child. And what's going to end up happening, the learning done in a therapy session will actually generalize to academic learning. And on top of that, you can actually integrate reading and writing tasks into language treatment, and things are actually going to get better. In fact, kids will spend a lot less time in therapy and have better outcomes. So what we do need to integrate in therapy, according to some researchers, is what we call academic language. Specific to school-based speech pathologists, we can target academic language goals, which will create what we call robust and generalizable impact. And what that academic language will include is activities such as metalinguistic awareness, complex syntax, discourse, morphology, and inference training. Because students with language issues, they require structured and explicit instruction to acquire complex language structures. And that part is very, very important. And all of it can be academic language therapy is essentially just can be incorporated in contextualized language intervention, basically 2 sides of the same coin. But it again is going to be very effective for those kids who have DLD and are impaired in the areas of language and literacy. Language and literacy. We should really be striving as, from a, forget about even evidence, from a logical and functional standpoint, we really need to be striving for an approach which integrates, reading, writing, and speaking tasks. The issue is that, oral language, listening and speaking, they're basically a foundation for reading and writing. If you're going to have deficits in phonology, in vocabulary, in syntax, you're going to have issues reading. Addressing these things together in early education is basically means these kids are just going to be reading stronger, writing stronger, and have better academic success. So we really need to focus on certain type of instruction. We have to know how to cleverly implement vocabulary, morphology, but we also need the phonics and the syntax in order to support spoken and written language. What's recommended in terms as a vehicle for this type of therapy? Well, lots of things will actually work. In fact, quite a few. What's going to happen is we want to use picture books. We want to use nonfiction texts. We want to use animated films. We want to use digital text. You can use pretty much anything. Speech pathologists are familiar with websites such as Wooks, which is essentially books on video, which come alive, very cute. Or Common Lit is a fantastic website. I just love what kind of fictional and non-fictional text we can get for our students to work for contextualized language therapy services. So it's awesome. And then what we're going to do using these thematic units, what we're going to do using that instruction, we're going to strengthen a lot of skills. We're going to strengthen problem solving. We're going to strengthen meta-linguistic language. We're going to strengthen pragmatic language. We're going to strengthen literacy skills. Kids are going to get better at comprehending text. Kids are going to get better at writing. These kids who have DLD, and of course other neurodevelopmental conditions, and it's ADHD, and it's genetic disorders, or be it neurodevelopmental disorders such as autism, they need systematic instruction. Instruction needs to be highly structured, and instruction needs to be highly repetitive. It's already 7:38, so for the purpose of this webinar, it's difficult to talk about, statistical learning and theory of learning, and I would love to talk about why that is so important, as well as the cognitive load theory, but for the purpose of this presentation, we're restricted to time limits, so unfortunately, that could be covered in other presentations. But they need systematic, repetitive instruction in order to develop literacy skills. Addressing language and literacy together will optimize intervention, and it will reduce time spent in therapy. Again, I know I mentioned it before, but I'm repeating that again. Here's another, one of my favorite topics, executive function therapy, which I will cover in probably 2 minutes or less. Language-based interventions will improve executive functions, such as cognitive flexibility and inhibition control. They will improve working memory. They will improve self-regulation. But standalone interventions will not. You want to improve executive functions, you need to integrate language into your work. Without language, it's not going to work. It's not going to stick as effectively. What the contextualized language intervention actually does, it will integrate executive function supports, the organization, the problem solving, the task flexibility, and it's going to be done within language and literacy therapy. Direct instruction in narratives and discourse, as well as reading and writing, will improve self-regulation and it will improve academic abilities. Executive functions cannot be done on their own. You want to improve executive functions, you want somebody to function better, it needs to be done from a language and literacy lens. Only then they will genuinely get better instead of providing you with an illusion that they're getting better. Now, in my conclusion, when it comes to ADHD diagnoses, many professionals are very quick to state it's all due to ADHD. Before making this claim, it's really important to remember that ADHD is a collection of symptoms. It signifies there is a deeper problem. It needs to be investigated and it needs to be meaningfully addressed. If you just say it's all due to ADHD, especially when there is inadequate testing, and you really poorly understand what's wrong with the student, that's really not going to be a solution to their legitimate language and learning needs. ADHD is not the default explanation for academic struggles. If a student is truly struggling with comprehension, expression, reading, and writing, you need to have a thorough language assessment. It is absolutely critical. We need to shift our focus from ADHD to language and literacy, and then we can ensure that the students with DLD will receive the interventions they actually need. Because we really need to set up these students for success in school and beyond. We want to make them competent members of society. We want them to go to college. We want them to have great friendships. We want them to have great romantic relationships. And we want them to have the job that they love, whatever it may be, so they can financially support themselves and be productive members of society. Thank you guys so much. I left more than enough time for me to answer all of your questions. I know there's going to be lots and lots, so I wanted to make sure I really devote as much time as possible to this. This is my website. You can go give your feedback. You can yell at me and complain to me, or you can tell me what I did well. And this is how you can contact me. And now let's go answer some questions.
Hi. Well, you are not wrong about the amount of questions that we have gotten. So I'm glad we have some time. This is awesome. I'm Elizabeth Hogan, president of the Reading League Georgia chapter. Happy to be with you guys tonight. Thanks for everyone who's joining us and who submitted questions and have been asking questions in the Q&A. I have it open now, and I'm going to kind of start there because I have some questions of my own, but I do want to get to the people that submitted some questions to us and that have asked some really interesting and important questions as you were speaking. So one thing that someone did ask that I kind of had a question about as well is that a lot of the educational assessments that you listed require a licensed professional to give, and many of us that are in schools just as a general education teacher aren't always able to access or give some of these tests. Or do you know, like, are there better ones that maybe a general education teacher or even a special education teacher could give that doesn't have, a psychologist degree or a psychiatrist degree?
So that's a very good question, and I'm going to answer in terms of what's happening in my state. In my state, you do require professionals. You would need to determine that a child requires a child study assessment. So in my state, you would definitely gather information about the child, and then you would have, relevant professionals administering the assessment. Now, when you go on a website such as ProEd or Pearson, you can actually look at your qualifications. And I believe ProEd and Pearson absolutely do allow individuals trained in certain things with a master's degree to administer certain things. But it also depends on your district, and it also depends on your administration. You may be in a position where you may not be allowed by your administration to administer that, and you may need a licensed professional to administer that. Informally or clinically, you can do lots of things. You can administer lots of different little probes, educational probes, to determine if somebody is having language issues. And those really don't require too much work. If a child is language impaired, just by using, the guidance from this handout and just tracking it in a checklist mode, you'll be able to tell right away. You won't need, to do that assessment, and then you can just refer a child to the relevant, child study team members for assessment.
Gotcha. Yeah, I know many teachers probably feel the same frustration that I do after, being in schools for many years, is that you know something's going on, but you can't always get the right people or professionals in front of the child and get things moving, especially in a timeful matter. So it's good for teachers to be equipped with all of this information. So thank you again. I was going to ask also just if you've come across any. I know a lot of schools now in Georgia where we are, we're doing universal screening of all kindergarten through third grade students. And
I think a lot of these screeners have started to become AI generated. So our students are sitting with a computer and interacting, and oftentimes they are mic'd and they're speaking into the computer. And I'm curious if you've seen any research or if you have thoughts about students being screened in this way for different learning issues, where an AI is actually listening to their speaking.
So a couple of things, because I noticed that Nicole Power made a suggestion that the teachers could be using this cubed screening to assess vocabulary and so on and so forth. And actually, if that's definitely a legitimate option for teachers, I would recommend that because it's also free. But I also wanted to point out the general research on screeners. Everything I've seen so far actually emphasizes that screeners are not the best. And most research I've seen on screeners that they really fall short, and many screeners will absolutely pass students who should absolutely not be passed. Now, the concept of AI doing screening is intriguing because everything is going to depend on what kind of, how well is that screener going to be designed. I think AI has a wonderful opportunity to step up to the plate. And if it's designed well, I think that it could be something, more sensitive, as long as it is psychometrically sound. The problem with screeners in general that I've seen so far, they're not psychometrically sound. And many of them absolutely do not pick up issues and are not sensitive. So that makes me nervous because AI, what is AI? AI became AI by studying humans, by studying their patterns, by studying their writing. Whatever prompt you put into AI, whatever you're doing is what AI is going to do for you. And if it's something weak, you're going to get weak results. That's all I'm going to say on that topic.
Right. Well, and it seems a lot of states are moving in that direction. And so then not only is there the issue of the universal screener not necessarily picking up these issues, but now we're also reliant on AI. So that's why something like this is so important, because teachers need to know this. I'm curious, and a couple of other people asked about what is the research around just the straight up comorbidity of true ADHD and DLD, or even and dyslexia.
Well, the true answer is nobody knows. Nobody knows. The numbers are wild. The current number I pulled from my infographic, which is going to be shared with you guys, is like 40 to 50%. But the truth of the matter is everything is muddled. Everything is, it's not clear cut. It's very confusing. So right now, we truly don't know what the true numbers are. Because first of all, if we're to believe, and if we really subscribe to the theory that ADHD is very wildly overdiagnosed, then we already have, a corruption of those numbers. Then if we're to evaluate DLD, what testing are you using? Are you going to use VTILS or are you going to use something weaker? If you use VTILS, maybe 100%. If you're going to use something else, I'm not going to name that because I don't want to give anybody any ideas, you may get 30%. So right now, it's a wild west when it really comes to comorbidity.
Yeah, I was afraid you might say that. So I have a question then about, as a teacher, how much we can rely on our school-based SLPs to have this knowledge. And since I am not an SLP and did not go to school for that, I'm curious about how do we advocate for SLP training? What is it looking like in the field for, I know I have a couple of college age friends and friends' kids that are becoming SLPs. Are they getting sufficient training, or is it something we should be advocating for them to have more information about this?
So it's very interesting because I think that question should also be asked of those students who are currently in college. Do you think you're getting a sufficient training? Are you getting a class on school-based language and literacy disorders? Basically, when I went to NYU, I had a class. Don't necessarily think it helped me tremendously because I had to teach myself quite a great deal. Again, this was decades ago. But I think that things are getting much better. I think there's far greater awareness about literacy. I think SLPs are genuinely involved more in literacy, but everything is really depends on how good your training is. And the truth of the matter is, it doesn't just depend on your training, but depends on your interest. If you don't have any interest in, literacy, but you're like the only SLP in your school, well, you know what I mean? So
Yeah.
the issue is it's very, very complicated. I think that we should be advocating, but the truth of the matter is when you start having these honest conversations with SLP, somebody says, well, I'm not trained and I don't know what to do. How are we supposed to insist that they're engaged in a task they know nothing about and can really botch the results? Or if somebody says, yeah, but my interest is not literacy, my interest is dysphagia, or well, let's use for the schools, my interest is AAC. That's what my interest is. Is it really fair or ethical for us to demand that that person, be engaged in literacy? And this is where it becomes one of those, both ethical, moral, and vocational gray areas.
Yeah. And that's tough. And many of us teachers know that, decades ago, we were not trained in structured literacy, right? Or in evidence-based literacy practices. So we're kind of relearning and doing the same thing. And I'm sure things are moving in that direction in other fields as well. So this is really interesting to see that we're kind of on the same path with that learning. Okay. So someone asked, do you have recommendations for students with co-occurring anxiety where their language disabilities are fueling that anxiety, but their anxiety is then inhibiting their participation in their interventions?
Yeah, I recommend pragmatic and self-regulation therapy and work on interoception. That's what I recommend. If you have anxiety, you have massive pragmatic language difficulties, you are perceiving the world in a completely different way, which basically means you need a lot of support in order to deal with that world because you're anxious and you have social anxiety. So you need work on pragmatics, you need work on interoception, you need work on self-regulation, but you do need language therapy, but your language therapy is going to look quite different.
Gotcha. Pragmatic. Okay. What do you recommend for an assessment of written language expression, a written language assessment?
Okay, really depends on how severely impaired the student is. If the student is really severely impaired, and I'm kind of hoping for that one, I do recommend the TAL, the Test of Written Language 4. There is another test called the TOC, the Test of Orthographic Competence. They're fantastic for kids who are really, really severely impaired. The problem becomes, what if a kid is not severely impaired? What if a kid is moderately impaired? What if a kid is more subtly impaired? And for that particular purpose, you certainly want to actually, engage in some clinical grade level assessments. You want to give them, as long as you know what you're doing and how to score that writing, you can give them persuasive essays or informational expository essays, and you can literally, as long as you know what you're doing, score them, and you can figure out how far, below their peers are. But in terms of standardized measures, we don't have a great deal which would be perfect for those older kids. Even the written portions of itself, they involve copying something versus producing new content. So in this particular case, really clinical assessments would be great for moderate and mild impaired students. And for severely impaired students, you can use the test of orthographic competence or the test of written language.
Okay, great suggestions. Thank you. So I think we're all kind of here. Another person asked, trying to sort the chicken and the egg problem. Will students with ADHD who don't have language deficits perform typically on evaluation measures, or will ADHD kids almost always present with some sort of language deficit?
So I had this conversation with somebody else today, clinical versus subclinical presentation. And this goes back to, there's lots of individuals who have disabilities who can function quite well in life. You may have a disability, but you can still function quite all right. And that would be kind of like a subclinical presentation. Or you can have a disability which is actively impeding your functioning. And that's the part of what we're trying to tease out. So the truth of the matter is, there is no right or wrong answer to the question because we don't have enough data. But there are individuals who may have ADHD, who are even taking medications for ADHD, who can function on those meds just fine, and they don't need any additional support. And even actually, and I'll tell you even better one, even if they don't do that great on testing, they're okay. They somehow have decent outcomes in school, in college, in relationships, and so on and so forth. It's the ones we worry about who can't function. That's who I care about on the tests. So to me, it really doesn't matter what's going on with that ADHD. I care more about what's going on with that language.
Right. All right. Okay. Are you ready to really dig in? People have some specific questions. Some of this I'm reading and I don't even know what I'm reading. So I hope that you do. Okay. So someone said, what are your feelings on the new Diamond test, dynamic measures of narrative language and decoding test?
I don't have any feelings. Actually, full disclosure, the publishers do want to send it to me, and they said they're going to send it to me, and I promised I'm gonna, look into it. But since I haven't received it yet, I have zero feelings on it.
Okay. We'll be awaiting your feelings. All right. Let's see. Oh, how much weight do you give to the language subtest of the general academic assessments?
Can we be more specific? Did they mention anything else? Because
They mentioned the WIAT.
oh, the WIAT, yeah. It's a lot more simplified. That's something you get in the TILs. It's their vocabulary and the similarities. Subtest. Well, actually, no, we have more subtests. Because this is not the. Let me think. So, I think some of the subtests are going to be more sensitive than others, but ultimately, if we're talking about, it's tricky because some kids are totally going to be flagged on those tests, and some
Right.
kids will do poorly. But then you give them something like the cells, and they're going to do way, way poorly. So you're starting with something which may or may not flag somebody, but if you give them a true language assessment, boy, are all the red lights are going to be blinking. So it's tricky, but I've definitely seen plenty of kids getting flagged on those sets. I've seen plenty of kids get caught in the WIAT. So I would definitely pay close attention. If you're seeing, poor results or weak results on that, that should definitely start ringing bells and loudly.
Right. I'm hearing like dig deeper. And this is really eye-opening for me because we do need to be advocating for these more extensive tests, which as a teacher for 20 years, I have not necessarily had any experience with. So this is, whew. Okay. Okay. Again, I'm saying some things I don't even know what I'm saying. Please give a clinically useful reference for interoception.
Yes. So interoception is the newest thing in speech pathology. We're just going to be in touch with our feeling, not just feelings, but not just, are we hungry? Are we thirsty? Are we in pain? Are we cranky? Are we irritated? And the truth of the matter is you email me and I will send you lots of references, including even lesson plans, because I have that in my practice at work and in private practice. So you use my email, you email me, I'll give you references and lesson plans. No problem.
Awesome. Okay. And I'll be trying to learn what that even is and how to say that word better next time. Okay. So I guess just to kind of wrap up, we are it's right at 8 o'clock. What is the best way that we as teachers and that also parents can advocate for our students who are looking really good? They're passing these really baseline universal screeners, which we know are not going to be necessarily great, or other even psychological assessments right at the average range, but we know that they're still performing poorly in real life and in classrooms. How do we push for this or deeper testing, I guess?
I mean, you collect the data, you present the data, you hope that somebody takes you seriously. But you have to start by collecting the data and showing something is definitely not right. This is not ADHD. You need to dig deeper. This is my rationale for why the student is not doing well. But you need to present something to the team. You cannot just go in and be non-specific. You have to basically say, I've collected my data. Here are my findings. These are my facts. You must do something about it, and then you leave the ball in their court.
Gotcha. And just to follow up with that, someone did ask, do you recommend any informal checklists that teachers or parents could use to possibly reflect or track, kind of collect that data on language deficits?
So I use my own, but I don't want to recommend them because they're paid on my website. So then I feel like I'm just trying to push for a product and I'd rather not. But in general, you can create your own checklist if you want to. Pretty much when you kind of like know the area. So here's a very quick example. Let's say you're looking into area of listening. Does the student understand messages? Does the student understand main ideas? Can a student pick out details in a sentence told them? Can a student answer verbal reasoning questions? So you kind of like, you can create one yourself where you're looking, okay, this is what's commonly related to memory. This is what's commonly related to speaking. This is what's related to vocabulary, and so on and so forth. You can basically sit down, really think about what does language encompass, listening, speaking, reading, writing, give it, and then give it to the parents, and you'll have something definitely viable. Or you can have a really detailed summary. Some of the parents provided me with fantastic summaries in addition to the checklist I have them fill out. And it's exactly very clear what's happening with their child.
All right, that's great information. And I appreciate you even telling us that there are some on your website as well.
Yes, but yes, I have some, and they're very detailed, but I'd rather not go the sales route.
I hear you. I appreciate that. And someone did say, and I think that someone just wanted your presentation, and I'm pretty sure that you gave us permission to send that in our follow-up email, your slides.
I would prefer that you do. This is specific to everybody. And again, my presentation has 0 affiliate links. It only has 1 link if you want to give me some feedback, but I don't even, the link is not even in the website, where it's only where I have blog posts. It doesn't have anything. So,
okay.
Yeah.
Okay. Well, thank you for that. And I know all of our attendees are super excited to have that. And we will be sending a post webinar email. Okay. Do you see anything else that catches your eye?
That's what I'm looking at right now. I'm seeing
I can see you looking.
looking at little hearts and little bouquets of flowers. I haven't been on Zoom in a while. This is cute. I love that. I'm trying
Everyone's showing love.
Somebody said the DLD project has free resources for teachers and families. Ironically, not ironically, but coincidentally, I just published an article there on DLD and ADHD, like literally less than a month ago. I think it was on March 31st. So you can find it there. Looking for any more questions. Cube 3. I think nothing in chat. I'm looking at Q&A.
I hit a lot of those.
Yeah, you hit a ton of those. I'm not seeing. Organizational skills training program for ADHD. I don't love that because I mentioned it has to be language involved. So that's not great. The website I mentioned was DLD and Me. Under articles section, you're gonna find very similar information, but DLD and Me does have some free resources. Oh, I forgot to mention a place where you actually can get free resources. Silly.
Yes.
Okay. SLPs for evidence-based practice. SLPs for evidence-based practice is where a ton of free materials is posted under the files section. If you give me 1 second, I'm going to send you a link in the chat. And I can't believe I forgot about the group. We have so many free materials there right now, including, I can actually post interception materials there as soon as maybe not today, but I'm gonna try to hit okay. Under everyone in chat, this is a group. Go to file section or just type in any words for what you're looking for, and you can grab a ton of free stuff. So for example, right now in their file section, there is quite a large number of files, maybe like 10 or even 15 specific to, we have emotion recognition and regulation training, free materials, how to develop cause and effect and reasoning skills in adolescents, how to do main idea and summarization training, how to do narrative-based syntax intervention, how to do focus stimulation for grammar, how to do complex sentence intervention, how to do metaphor and ambiguity training. So we have lots of free stuff. You can just hit download, and it's not for SLPs, it's for everybody. Parents can join, we just prefer that they don't comment, but just like copy the resources. Teachers can join. You know, the discussions are for SLPs. Everybody else can grab the materials and, you know, all good.
Wow, this is awesome. And we will try to collect all of these websites as well to also send along with your presentation, all the ones that you've mentioned. This is amazing. Thank you so much, Tatyana. This was awesome. We are really, really, really grateful that you spent this time with us tonight and spent extra time answering all the amazing questions that our registrants asked. I just want to say in closing, thanks for everyone who joined us, especially you. We so appreciate your expertise. And we appreciate everyone who registered, submitted questions, asked questions tonight, and joined us for our webinar series. It's been a great one. If you have colleagues who missed tonight's webinar, let them know that all the registrants will receive a link to the webinar as well as the slides from the presentation tonight, like we already mentioned. You'll also have the opportunity to fill out a knowledge check request for a certificate of attendance. So after viewing the webinar live or recorded, the form will be sent early next week, and you'll have approximately 1 week to resubmit the form. So when you fill the form out, you'll receive your certificate of attendance the day after the deadline for submission. So on behalf of the boards of IDA Georgia and the Reading League Georgia, we appreciate you attending the webinar this evening and all the other webinars you've hopefully attended in this series. We hope you have a wonderful night. Thank you.
And thank you so much for having me. It's been a true pleasure. I loved being here. Thank you guys. Bye.